Hey there, my name is Haley and I don't have a bladder. Yep, you heard that right. In honor of September or Urology Awareness Month, I'm going to be sharing my life with a urostomy with you in a series of short videos. Now, you're probably wondering how I pee if I don't have a bladder. Meet Illy. Illy is an ileal conduit urostomy. She is a little section of small bowel called a stoma that drains urine from my kidneys to the outside of my belly. Because your kidneys are constantly making urine, this little volcano is constantly leaking urine. It's collected in this bag where I can empty it into the bushes or a water bottle. Perks, you know. I have no control over the urine flow, but if I get dehydrated, then there's more pauses of time where she's not outputting. But I have to change my bag every 3 to 4 days, or I could have a blowout leak. And it takes me anywhere from 7 to 20 minutes, depending on how active she is. Sometimes she is so active that she squirts out urine like a volcano erupting, and other times she's just slowly leaking. And the weirdest thing, if I sit there and watch her during a bag change, she moves around and sort of turtles in and out of my abdomen, which nearly made me ill the first time I saw her do that. She isn't painful though. It's a lot like having an ostomy for poo. The only difference is that it's urine, not poo. And a lot of nurses get confused about that since urostomies are more rare than ostomies. I actually low-key got into an argument with a nurse once about it. So believe it or not, I have to educate most nurses, or they will assume there's poo in my bag. The surgery recovery was extremely rough. I was on TPN for a month in the hospital, and the first few weeks, I couldn't even look at Illy without feeling like I was going to faint. I am almost 3 months post-op now. I had my surgery the day before my 28th birthday, and she was the best birthday present I could have ever asked for. She truly saved my life, and my quality of life is so much better now. I'm actually editing a vlog of my surgery recovery currently. I mentally could not handle changing my bags. The nurses had to do it for me, and that really surprised me because I was a paramedic and I was used to looking at disturbing things, and I kind of enjoyed it. I loved being a paramedic. But when a piece of your intestine is sticking out of your body, it's a little bit different. It's a very visceral feeling. I've been wearing my urine as an accessory since like November of 21, so a few years. I'm definitely not embarrassed anymore. Learning to love my new body has been quite a journey, and I'm excited to share with you how I got there. I've learned to trust my intuition a lot more now and to stand tall when doctors tell me I'm fine when I know I'm not. Still healing and I still have some growing to do, but I still struggle with constant hypervigilance. I'm always worried about my bag leaking, developing a kidney infection, my hydronephrosis needing a kidney tube again, getting a hernia because I don't know if you know, but wheelchair users are at increased risks for developing a hernia if they have an ostomy of any kind. This has been one hell of a journey for me. And to be honest, it wasn't the easiest to share, but I haven't seen anyone else on YouTube with a urostomy. So I feel a personal responsibility to put my experiences out there for others going through this too. So subscribe so you don't miss future urostomy content.